I have quite a number of decades of experience in digital healthcare and digital transformation in healthcare. Um, my current role and previous roles have obviously been at a very senior level within here in the UK public health services. As as in these roles, the scope and sphere of my responsibilities, if we think of the alphabet, the English alphabet A to Z, anything from analytics and business intelligence right all the way through to technology and everything in between. So cyber security, digital training education, clinical information governance, etc., devs, service desk, etc., network system engineering services. So quite a portfolio of responsibilities. As you indicated, I've worked in I say that there's 5 kind of health and care domains here in the UK government public health and care services. So acute, community, primary care, mental health, and finally what we call social care. And social care has recently just been bolted on with the traditional healthcare services. So I've worked in all bar mental health, so I have exposure across them. Work very closely with colleagues in NHS England, because I'm based in England, in hospital in England, and work very closely with our national colleagues in NHS Digital, NHS England. Yeah, that's I suppose me in a kind of nutshell. Yeah. Well, in this respect, I would say really the pandemic, the relationship and engagement between clinicians and patients, one that's never really been recognised to the extent as it has now. So I think that's been instrumental in the advancement and adoption of remote care solutions across the health and care space, not only in the public, also in the private sector, private healthcare here in the UK. So I think the pandemic has been instrumental in that shift change, and also in that culture change that we've seen. We're seeing a greater reliance and dependence on local support, coupled with remote care solutions. So I may use this as an example throughout to give some kind of testimony to my answers, but particularly where I have seen and my clinicians have seen has been in areas such as what we call care homes, predominantly used by the NHS and the government here in the UK and the public to move particularly frail and elderly patients into care home settings where their acuity levels are quite low, and it can be managed in that care home settings, but still being managed by primary care clinicians, as well as where they are still under the clinical management of secondary or tertiary care clinicians. So I think we've seen care home staff taking a greater responsibility for that patient cohort particularly. So I think that change in responsibilities, as I say, has been orchestrated and manifestly driven by remote care solutions that have come to the fore. Really, there were some pre-pandemic, but they really have taken off on the onset of the pandemic. And I think that's been recognised by clinical systems vendors who have been able to support their remote care solutions in that kind of modus operandi, as I would say. And also for our clinicians, whether they be in secondary care and primary care, wherever, whatever the setting, their ability through remote care solutions to be able to work in a very much mobile context now, rather than having to be set in a physical hospital or primary care setting. So, and really, again, the pandemic was at the forefront of that significantly. Where here in the UK, and I'm not sure whether in India this was the case, but here in the UK, when the UK government announced publicly, it was something like the 20th of March 2020. I remember it visually, 20th or 21st of March, when the public announcement was made. The government mandated the closure of front door hospital and primary care services. So suddenly, overnight, we, from a digital perspective, needed to look at how we can mobilise our clinicians working remotely and supporting remote care services to the public and to their patients. So I think that was another feature. Two other things I would also suggest were instrumental were, and possibly subsequently as we come out of the post-pandemic era, the development of clinical apps. So in mobile devices such as what we all use day to day, we've seen a real advancement in mobile app services to support patient and clinical care. And also through that technology, the advancement of network communications is critical to this. And here in the UK, we are now, our major network providers, BT, Vodafone, etc., they are upgrading their network infrastructure to support 5G technology. So I think these are all been instrumental in supporting the development and advance of remote care solutions. And I mean, the UK government had a series over the 2-year pandemic period of what we called lockdown. So the public were mandated to stay indoors. So we needed a mechanism by which we could support our clinicians and engagement with our patients through a technology medium. Yeah. And I say that, I think, from a number of perspectives. One of the things that we've been challenged here, we are a public service here in the UK, government public health service. And prior to the pandemic, one of the challenges, whichever government of the days in power, has been what we call waiting lists. So, me, Phil Scott, I've been diagnosed with a condition which means elective surgery, but I will be put in a waiting list and determine on the priority, etc., capability of the service to support that. And what prior to the pandemic, our waiting lists were gradually kind of coming down here in the UK, but the pandemic really created a real monster for us, and currently across just England alone, we have something like about 7 million patients waiting for elective surgery, and some of these quite a significant number over 2 years wait, which is really disappointing to say as a citizen of this country. Our population are faced with that dilemma. But so one of the things where remote care solutions are now seen to address that particular issue politically and clinically is where the NHS England, who are the kind of the management of health and care centrally within England, we're now moving to areas where through remote care solutions, virtual consultations supported by clinical monitoring tools, now taking what we call, when you go on a waiting list, your first thing when you're referred by a GP, because that's your first point of contact, clinician, they will consult you, and then if they feel they need to refer you to a specialist in hospital, a general surgeon, for instance, you will have what's called a first outpatient appointment. And in that respect, what coming out of the pandemic, as our waiting list exponentially increased in numbers, what NHS England are now doing is looking at these first outpatient appointments